learned it really nicely, and you have explained, how did you explain these things was amazing. You have explained all the clinical research, data, and the drug development, all the, study types very nicely. Okay, so we can take up the questions, guys. If you have the questions, you can talk to Miss Neha, or you can write in the chat box. Okay, so there are some questions. If I'm not okay. Okay, SAS is required for CDM? Not at all. It's not required. I think Dr. Tarun has answered. Okay, so Mr. Karthik Raj has one question. I worked as a data manager intern in Indian Council of Research, Council of Medical Research, ICMR. Is it useful to join in pharma?
Yes, so yeah, Karthik Raj. So it's good to know that you already got a chance to work as a data manager as an intern. But yes, of course, you will always have an pharma is an pharma are the base sponsor of all the activities in clinical trials. So definitely you should give a try, and it's a big, huge scope. And giving the background you already have started building, it will be obviously helpful to join pharma. And yeah, pharma does have, if you're still keen to be as a clinical data manager, pharma still have departments where clinical data management is performed. Like I mentioned in the slides as well, they are one of the employers for CDM.
Yes. There are some more questions. If you can take up, Neha, or shall I read for you?
No, I can take up, no problem. Okay, I see questions from Avinash Shavan. Is there any possibility of automation comes to industry? Yes, very good question. I was expecting this question. So yeah, I would say automation. Yes, everyone's scared. Like, what about AI, ML, and everything comes up. And okay, we don't have jobs. Data managers don't have job. No, it's not going to happen. You know what? There is one thing which automated machines don't do: thinking. It's very crucial. Thinking you can't do. It needs intuitive and conscious to think. And in data management, like I said in article, thinking, how you have to, foresee the risk and everything. Not all the data, where there is no data, they cannot tell you that what are the risks, right? So I will suggest, and also that for a group, I had this suggestions as well. There is a book called Thinking Fast and Slow. If you want to note it down, there is a author called Daniel Kahneman, which has written Thinking Fast and Slow, that how thinking really slow makes you different from computers. Okay, computers cannot think. Even if you want to mail like then unless and until you are technically glitch, I mean that there is a technical glitch, computer will slow down. Otherwise they can think fast. Obviously they can work fast as possible. So yeah, so there is always intuition and conscious reasoning you'll have to provide as a human. So no.
Right.
And also one more point, one example which because this question I was expecting, it's not about solving the problem, it's about defining what exactly the problem is to be solved. What is the problem? So that's what we humans do. All right, so I think I elaborated my question enough to answer your question, Avinash. Yeah,
I'll take the questions. Next question is from Jacob. What is the average salary for a clinical data manager? Yes, Neha.
Yeah, okay. So yeah, average salary, like it starts, I can say from its average, you can say from 3 to 4 lakhs per annum to it goes to, like if you ask for India, it goes to 12 to 18 lakhs. Yeah, average. I'm saying average because once you start, you are a performer, you will see an high salary growth like anything. And once you have experience in different organizations, when you hop in with your experience with the different level, at the different level, if you can ask for more, it's always a negotiable thing with the skills you carry.
Yes, I can give an example. For example, if you take Cognizant is giving 3 to 4 lakh package for freshers, and for 2 to 4 years of experience, they are going up to 7 to 8 lakhs. Okay, somewhere around 6 to 8 lakhs. So you can figure out from there. Okay, if you have 5 years or 6 years down the line, I think that is in the Indian scenario. Yeah. And extending this question, Neha, what about in abroad, salary wise?
Yeah, abroad, so with experience, obviously it increases, but abroad, if you ask me, in UK, it starts ranging from Yeah, it is still 1,11,000, 1,20,000 pounds in UK. And also for in US, if you see, it's the maximum you can reach is from 1,70,000. But yes, of course, you can start with 30,000 pounds or $40,000 in UK and US respectively. So you can start with that.
Okay, thank you.
Great.
With is asking, how can an M-Pharm fresher get into CDM job, or can an M-Pharm fresher get into CDM job?
We have a lot of questions from here from YouTube, and I think people have asked in our registration form also. So yep, go ahead.
Yes. Okay, I take this question from Mohit. Okay, yes, of course, M-Pharm fresher can, get into CDM job. Like I said, that you should have a knowledge, and obviously they won't be expecting you as a fresher that you should know everything about CDM. But yeah, the basic which we are planning to cover in the course, you should know, and it's a good thing. Basically, if you are an masters, it will give an value add as well to a CDM job role.
Yes. Can CRC enter into CDM? Ramchandra is asking.
Yes, definitely. So I have lots of colleagues who have come from CRC,
I have
CRA
raised
role.
view duration. Sorry, please go ahead. I'm sorry.
Okay, no problem. So yeah, for CRC, if you are a CRC or an exam, that is a value add again, like other things, to move on CDM. Why? And there are also benefits. So yes, you know how things work at the site level. So the same thing on the other side, you can easily move based on the background you have while working as a CRC. So you can easily move to CDM. That's no problem.
Yes, Pravalika is asking, how can a PharmD join as CDM? I think,
how can
yeah, she means maybe can a PharmD join CDM?
Yes, of course, PharmD can join a CDM. Like I said, also there is a thing which if you join as a B Pharm, as a normal graduate, as masters and as a PharmD, that makes lots of difference with the degree you hold and plus where you, I mean, how you want to approach as a CDM. If you don't want to go as a work as a clinical data manager, there is always an option open. Like Dr. Ajit mentioned, like in at any level, I have seen people after doing a pharma, even a lab experience, after working in labs for research labs, they have moved to CDM. So
yes,
it's for
yeah,
everyone, I
definitely.
can say.
Yeah, definitely. You see, anyone, a B Pharm or M Pharm or a PharmD can join as CDM. And here your knowledge in clinical trials, clinical research, and knowledge on therapeutics, especially for PharmDs, will be advantageous for the recruiters. So they will immediately take you if you have a PharmD, right? Yes.
Yes.
I think the Harsh Patil is, the similar question. I was working in pharmacovigilance after BPharm. Now I'm pursuing my post-graduation, this PharmD post-baccalaureate mostly. Yes. So is there any scope? I think we have discussed this question right now. Okay. So.
Okay.
Instead of SAS, SQL is good to have skill. Sujit Das is asking. No need of any SAS or SQL specifically needed for a clinical data management. Yes, you need to have a little bit of understanding in Excel.
Right.
And other skills will be taught in the course. So programming wise, absolutely not required at all. If you have, okay, it's an advantage, but
it's an advantage. Yes.
Yes,
It's not mandatory thing. You should to know. You need to know SAS, but yeah, for SAS thing, language thing.
Okay, I think we have answered the Jacob's question also. How can a BPharm fresher land a CDM job?
Yes,
okay.
It's the same question we answered.
How can a M-Pharm space? Okay, M-Pharm fresher land into the job. Okay.
Dr. Rekha is asking, is there any opportunity for a teaching professional to join CDM?
Oh, that's
or
nice
any
question.
age limit? Yes, Neha.
PG professional, as in I am not getting what specific professional you are. Okay.
I think she is a teaching teacher. She is a professor. She wants to join CDM. Or like her doubt is there any age limit?
No, there is no age limit. I mean, you have the skill, where you want to see. If there is no age limit, there is no restriction that you should know before entering into CDM. That's the reason CDM is, growing this much. What all you need to know is to know what is CDM, what you're going to do, and you would like to want to do that.
And I think her question, I think her question is that Is there any added advantage if she is in the academics? Dr. Rekha, you can ask your question directly. You can speak up to Neha.
Yes,
Yeah,
please
good
unmute yourself.
evening.
Yes, please
Thank you,
unmute
Dr.
yourself.
Ajit, for giving me an opportunity. Good evening, Neha. This is Dr. Rekha here.
Yeah, hi, Dr. Rekha.
Yeah. Yeah, I was working like in a professor from last 15 years in a teaching category, like in a pharmacy college. So thinking of shifting, so from last 3-4 years, but I'm not able to get into or join into because of teaching experience. There is no opportunity to join CDM, but I'm
Right.
interested to learn new things, bugged up with teaching. So I just wanted to know,
Correct.
is there an opportunity for us?
Right, right. So, yeah, 15 years is a big experience. Wow, bravo. So,
No.
yeah, I mean, yeah, definitely they will think about why they should hire you, or typical cliche questions which comes up, that why they should hire you if you have already so much of experience in teaching. So,
Correct.
yeah,
Correct.
what they will expect you to know, main reason how you connect that you want, main reasons like
Yeah.
why you want to move to CDM all of the sudden. Like,
Correct.
yeah, even for me they will ask me why you wanted to do masters at this,
Correct.
after doing all this experience, you have a lot of experience, so you need to
Correct.
know, I mean, why you are interested, study on that, put things together, like, and know that. And obviously if you know all the data, you will be able to crack an interview, you'll be confident enough that, okay, to answer them, that yeah, why
Yeah.
I want to, these are the areas which I want, keen to learn, and there is no
Correct.
age factor which should come back to you.
Okay. Thank you so much, Neha. Wonderful talk. Thank you.
Thank you. Bye-bye.
Yeah. Thank you.
Okay, so we have some questions from Karthik Raj again. What about the scope of biostatistics as well as data manager? I mean, being a data manager, I think he's asking.
The very first question.
No, I think the question, what about scope of biostatistics being a data manager? I didn't understand.
Biostatistics being a data manager. Okay, so I know as a biostatistician, they are the persons who work very closely to data managers. But if you're planning to move from biostatistics to CDM, that you have an opportunity as well, or you want to just know how closely they work, then it is very close coordination between clinical data management and biostatistician. So I don't know if I'm able to answer you properly, or you are planning to move
Yeah.
to CDM. That's what your question
No,
is.
no, no. I think you're right, Neha. So yes, definitely an understanding of biostatistics will be an advantage in clinical data management, definitely. But
Yes.
biostatisticians have their own department with whom we'll be closely coordinating and communicating as a CDM or as a clinical data manager. So the scope of biostatistics is limited in clinical data management, but definitely an added advantage. If you have an understanding of biostatistics, you can communicate more easily with that
Easily with
particular
the
department.
yes, data
Yes, yes,
manager.
yes.
Because you will get eventually the data from the data managers. So you need to
Absolutely.
know
So
that how they are retrieving the data.
yes.
Any fresher needs some training and basic knowledge of clinical trials and basic understanding of CDM to enter the field? Of course, I mean, definitely.
Yes.
Okay. Okay, so Karan Goyal is asking, if experienced in pharmacovigilance aggregates, what all books and websites are good to move into CDM? I think this is about references.
There is no specific books, but yeah, as a general global guidelines we follow, it's you can go through ICH GCP guidelines. There is a good clinical data management practice guidelines which we go through. But yeah, they are more into technical. When you read them, they are like more into technical levels. So there are lots of resources you have. It's as per your interest, how much you want to look into. There is lots of advancement. But yeah, every time you work, you need to have the basic understanding before you hop on to to read any book. You won't just get it if you just start reading the technical words, because book they do not give you an they give you a definition, but books will expect you to have at least basic understanding of the CDM. So yeah, I would recommend these are the standard guidelines which is available for everyone, which you can read.
Okay, yeah, Apeksha, online course is available. For this CDM, our course is online only. Our accelerator course in CDM is online, 100% online, Apeksha. Okay, so I think Honey, Neha has told about all the companies, all the industries which are, which are there in the domain of CDM and where you can apply. So you just have to go to the websites and check out.
Yes.
For fresher, CDM salary starts with 2 lakhs. Okay. Is US starter salaries 50,000 pounds or okay, that could be. M farms can join, yes.
Okay, there is one question from Karan Goel. I say if there is a course in India which is also well recognized in abroad, any government courses. So when it comes to abroad, guys, what I would tell you that any small abroad has a very high education evaluation thing. So your major degrees, they will get evaluated and you will see the grading system is very different. Okay. But they would not even say like, even I have done my certification, but they do not evaluate the short courses, certification courses, PG diploma courses. Why? Because their education system is way different and the grading system is way different. But this certifications and everything, the most biggest thing you will have, that if you do any course or any certification, it will be there on your resume. So it's on going abroad. If you are planning to go abroad based on your education, it will also play an important, just as in that what other certificates and what or other experience in learning experience you have. That way that will carry a very big weightage. That's what I have used. So I can say that my PGD certification, which I already have in clinical research. So yeah, you can obviously you don't have to be say that okay, it is recognized, then only I can apply jobs abroad for CDM and everything. No, it's an value add in your resume itself. When it stays in resume, it says something.
Yes.
Okay.
Karthik is asking, is there any software in this? I think he's
software regarding.
I don't know whether I should ask this or which software used for presentation. Oh,
Okay.
I think he's appreciating your slides. Okay.
Thank you, Karthik. I take it as a compliment.
LaTeX? Okay.
No, it's lots of work on it, so don't bother to ask it.
Aditya, your question is a little out of CDM, but if you want to become a SAS programmer, we can help you as well. You can contact us separately. Okay. Can R programming replace SAS? Not in the near future. They are competitors, but definitely they have their own place in the industry. Okay.
Yes.
Yeah, you can definitely learn R as well.
Yes. Thank you, Sujit. Of course, the session was really wonderful. Thank you very much. Okay, so Karan Goyal has a question. Which are some of the best courses online, offline, which make you entry easy in CDM? Of course, our accelerator course in the CDM.
Yes, of course. We are making it extensive. I mean,
yes. If you are going out, you are making it expensive. We are making it very cheaper and very good learnings for you. You can see. So definitely, our accelerator CDM course will be helpful for you. Okay, I'm a B.Pharm first year student and I'm glad to have this kind of informative session. Thank you very much. Thank you, Helen. Sir, this will be a course that we can request to take later if we cannot register now? We are not sure when the second batch will come, because we are not sure when when our Miss Neha will be free next time, because we are conducting all the courses at CLIMED live, 100% live classes, no recordings. I mean, no recorded classes. All classes are live. So I'm not sure. So
you can ask your question if you want to speak.
Yes.
Okay.
Aditya Gupta, I would highly recommend learning R and Python. Okay, so we are coming up with R also, but in upcoming month. Okay, can I join CDM course after completing PharmD? Yes, you can join even before. If you are in internship and all, you can join. Yeah. Okay. Okay, so Avinash Chauhan is asking, I'm joined in TCS and CDM as fresher as trainee. My current salary is not good. So please tell me when I will switch TCS and what is the highest salary. I don't think in India, what do you say, Tarun? What's your take on this question? I will ask Dr. Tarun.
No. I mean, as a fresher, don't worry about salary. At least get minimum of 1 year of experience wherever you are. TCS is a very good company. Okay,
Yes.
after 1 year, you can then try to jump from one MNC to other MNC. Then you will be in demand. I would recommend at least 2 years in of experience. Then you will be in demand. Okay, we will also guide you if you are somehow related or connected to Climate. We can also guide you about your opportunity in abroad as well. Okay,
Yes.
so don't worry. Try to learn as much as possible when you're as a fresher.
And TCS is a wonderful company. Don't worry about.
Absolutely.
Yes.
Thank you, sir.
Nitish Kumar, what are the scope of CDM along with AI? Oh, that's a nice question. Neha, would you like to take this?
What's the scope of? Yeah, I think so. It's on the similar line which I said. I don't know the technicalities of along with, AI, but yeah, there are several parts when it comes to big data, which comes big clinical data, which comes with AI's forms of several forms of AIs are implemented, and that's the reason I mentioned and stressed on that point that data management is just not data management. You are becoming at the scientific level also you're getting, and technically also you have a connection. So yeah, depends on what role you are moving to and what kind of projects you are working on. You will surely definitely get if you're interested to work with, where there is an advancement in data handling thing.
Okay, there's one question from Karthik Rai. I would like to take this question. Will you arrange placement? See, till now, for every course, whatever we are launching through Kilimed, we do not promise any kind of placement, guys. We do not promise. But definitely, as our medical writing course is going on, as our SAS programming is going on, we help our each and every participant. We help them in getting references. We help them in getting interviews. We help them definitely, but we do not promise 100% placement to our participants. This is a purely learning based skill development programs what we are running right now. Okay, we are running educational programs, quality educational skill based development programs. We are not providing any kind of placement promises. Okay, so and why we do not provide, there are the things, because people provide the placement for 6 months, 1 year, or 8 months. They charge from the company also, they charge from from you also, and your salary will go into the that things only. I would not like to comment on those, but from our side we do not provide 100% promises on placements, guys. But we help them because our all the mentors, our people, our network is there, a big network in industry. We help them getting into the industry.
Okay, Vishwanath is asking, is there any software used for CDM? Neha.
Yes, there are several softwares used in CDM, like one on for the live data, which is incoming on, I can say big softwares like Oracle Inform, Medidata Rave, and there are small software, so as Open Clinica, some softwares which are free for some small CROs which you are starting with. So yes, so there are lots of software, depends on and even the which is a big software which has come is Viva Vault. Viva is a big software in the company. So yeah, lots of softwares for CDM. It's not only stick to one. Yeah.
What are the timings of Climate CDM course? Okay, so there will be the timings. We'll be taking classes every weekend, maybe after 7 p.m. because it will be convenient to Neha also. After 7 p.m. and before 7 p.m. we have other classes as well. Frankly, we have medical writing class, we have SAS classes, we have SPSS classes, multiple things. So after 7 p.m. in the weekends, 1.5 hour to 2 hours classes, more than 1 hour classes every weekend. So in the weekends, Saturday and Sunday, sometimes maybe Friday, but definitely Saturday and Sunday classes after 7 p.m. this time.
Yes.
Okay, Jacob. Okay, I think okay. Then this person involving software, random and CDM and its details. Yes, Vishwanath. Okay, wants to whether this is useful MSc biostatics. Yeah, I think things we should take. Okay. Is there any other questions, Dr. Tarun, we can take from end?
Yeah, I can. Neha, Vishwanath is asking, are we providing hands-on like for the softwares that you have just mentioned?
Yeah, not all softwares, because like, the softwares are owned by the organizations, but we would try to give an, a visual training if we get a chance, if we have an, a
Yes.
demo which we are able to access.
Yes, yes, yes.
Yes, yeah.
So in terms of software, it is not again involving any programming or coding, right? So it's
Yes.
just click and drag using your keyboard and mouse mostly. So in other words, it's like mostly a database on which we are working, right?
Yes, and knowing
So
the navigation, which is the
yeah,
usually a initial challenge, to know the database and see them, like, see the database, how it looks and how you are you're navigating it. Because yeah, it is again little bit technical. So if you know in advance, you work well. Yeah.
yes, definitely there will be a class on that. Okay.
Yes.
Okay, so people are messaging me. People are messaging me personally, guys. So, out of the box, Neha, I'm so sorry. Dr. Tarun, I'm so sorry. People are asking for, the instant discount. We did not decide it before, but if you are registering now, you can just pay 18,000 for this course. See, we did not decide any kind of discount because this is the fixed price for this course. There are no discounts on this course, right, guys? But as you are attending this webinar, we always come up with some discounted prices.
Yeah,
People
I
are
think
messaging me.
whoever is attending this webinar, I think if they are paying, want to register today, I think you can have some discount. Right?
Yeah. So you can pay 18,000. That's what 10% discount again I can do for you guys. So if you want to register today, you can just contact on my phone number, and you can directly register. You can directly, I'll guide you how to pay and how to register, because we do not have any link for that. Okay, so you can contact me or contact Dr. Tarun also for that. Okay, and if you want to pay within 24 hours, maybe by tomorrow evening, we will end this, just because you guys are requesting, and I'm getting many requests. I got 4 or 5 requests, so 10% discount for you if you really want to register now by tomorrow evening. Otherwise, no discounts on this course. Thank you.
Okay.
Okay.
Any other questions, guys, or we have questions from YouTube? Or...
Okay, so I have some questions. Let me check. There are one or two very interesting questions from the registration form we got, Dr. Tarun.
Okay.
What is the advantage of being a clinical data analyst over the other fields of research? This question I really liked a lot. That question was asked about, and from my intern, our interns only, Ellie John is asking that question. She asked that question: what is the advantage of being a clinical data analyst over other fields of research?
Yes, Neha, do you want to take this question? Okay.
Yes, I would love to. So, yeah, the clinical data analyst, like I have, covered as much as, information, why it is so important and why it is, why you should take clinical data analyst or clinical data manager job, is like you will be playing part in multiple steps of the clinical trial. Plus, you open your opportunities for yourself, as for the career growth. You do not just stick to one activity all the time during your career growth in CDM. So you get the chance in flow laterally, even during the management in the operationals level. If you think on the higher end, you get to move to the operational level as well, which involves lot of weightage on your work profile, which will be obviously directly interacting with the client leads and the big pharma sponsors. And once you have that, obviously you healthcare, once you are a prime healthcare worker kind of thing. But yeah, obviously the technical work, because if you find healthcare workers, it will usually give you the other profiles. But yeah, CDM, they put a lot of importance to the healthcare because of the clinical trials they participate into, and they analyze lots of important things, eventually leading to a successful clinical trial. So I would say it is not very narrowed down field. It is a vast field where you'll have lots of opportunities and others specific technologies to touch base, and you can even grow in some different directions from starting, if you start from clinical data management. If you I won't compare with any other fields directly, because everyone has their own importance and interest. But yeah, this has a broader scope, I can say, rather than other clinical research. It's not just sticking to the one thing.
Yeah, so quickly adding on to what Neha has said, CDM is like plays a central role for all the other departments who So the data that is generated in clinical trial at the site level is being handled by the clinical data manager. So whoever it is, whether it be the sponsor or the SAS department or regulatory affairs, all the departments, if they want data, they have to come to us. And we, as a clinical data manager, have the power and authority to give the data to them and also manage the data. Okay. And coming to the job scenario, it's like a typical software job, 9 to 5 and Monday to Friday kind of job. And to add to that, CDM have a special advantage of working from home. No other jobs in our clinical sector has this advantage. In maybe not, if not initially for freshers, but down the line, if you are looking or interested from to get into work from home kind of scenarios, CDM is a perfect opportunity for you.
Sapala.
Yes, true.
Yeah.
Okay, so any other questions, guys? If not, we can take off. And if you are wishing, you are willing, you register now, or you can think of, and you can contact me if any kind of query about the payments, about the fees or something. You can directly contact me or Dr. Khan. That's okay. Okay. So yes, lifetime work is possible in CDM, and you can go to any kind of any type of highest level in the industry.
Yes.
To director, up to the president, vice presidents of the company level. Yes.
Yeah, I mean, yeah, people have, I've seen I'm in my network, people have grown till the VP of some big CRO,
Yes,
because you have worked from the bottom of the CDM. What is CDM? They were like, you see the growth as like they were just doing the data entry when there was only paper studies, and they are now like VPs of that CRO, some big CROs. So it's all on you how high you want to aspire and pursue for in CDM. That's the reason I said it's a vast scope. Yeah, vast scope.
Correct. Okay, so I'll write my contact number here, guys, if you want to. Okay. Yes, Karan, I'm writing my contact number. This is my contact number. You can WhatsApp me or call me. No problem. Okay, guys. So I think we are done with the questions. Long session, but amazing session. I love that kind of interactive sessions where people come up with a lot of questions, lot of doubts, and they clear their doubts. And I really believe people come up with the doubts when they're interested. Okay, so I believe this is a really good area, and you all are interested to learn. And someone is asking someone's personal question to me, sir, after this webinar, are we getting can we get a job in CDM? See, conducting webinars and how the webinar helps you definitely in getting the knowledge. So if you're going to some fresher entry job level fresher entry job level interview and all, it will definitely help you, because after this webinar you will have an idea of like CDM, what is CDM, what is the workflow of CDM, how it does and how it works actually. So you will have that idea. Of course it will help you, but this webinar itself, if it is giving you the job, that's definitely not. But you will have an idea, you will learn from the webinars. So I always try to attend as many as webinars, as many as conferences, workshops, to learn the new things. I don't know where in my career, where in my career path I come across such questions. So I learn from everything, and that's why we conduct a lot of workshops, webinars, so you can also learn, right?
Right. Yeah. I mean, yeah, it's like I agree with Dr. Rajit. I mean, webinars help us a lot to understand about what we are thinking about, like about that domain, like clinical data management.
Yes. Yeah. Rafia Jabin, definitely BPharm students can join, and also the students who are still studying, or undergraduates, or still third year or fourth year of BPharm, or final year or fifth year of PharmD, or MPharm students can also join. That is the main reason why we are conducting the classes on weekends.
Yeah.
Okay.
And see, if I take this question from another way, even the BPharm running students can join, definitely yes. But for if people can grow in the CDM industry after BPharm itself, our Miss Neha is the